Okay, so it's just gone 11 o'clock. I'm going to go ahead and start. Good morning, everyone, and welcome to today's webinar, which is aimed at educating members of the public and arming you with knowledge on all things dental. Today, we have the pleasure of welcoming Professor Riaan Mulder, who will be discussing the topic of dentures or false teeth, as they are commonly known. Prof. Mulder qualified as a dentist in 2007 and holds a master's degree in restorative dentistry as well as a PhD in pediatric dentistry. Since 2019, Prof. Mulder has worked in the prosthetic dentistry department at the University of the Western Cape, where he trains dental students. He also treats special needs and geriatrics patients in various aspects of dentistry. Prof. Mulder also has a keen interest in research with an extensive portfolio of 68 national and international journal articles. Without further ado, I'm going to hand over to you, Prof. Welcome and thank you for joining us.
Thank you very much, and thank you for Sada for giving me the opportunity to share some general information to the public in order for us to really ensure that we know our false teeth or our dentures, and that we are also able to debunk some of the items that we sometimes see on the internet or on Instagram or these other social media platforms, that we actually know what we are putting into our mouths and also know when we need to go visit our dentist. So thank you very much to Sada. I work at the University of the Western Cape, which is one of the largest dental universities in South Africa, and we're located in Cape Town. I also have a private practice in Durbanville, where I practice after hours. So today we're going to look at our topic known as Know Your False Teeth or Know Your Dentures. And when we see this image, as we can see here on the left-hand side of your screen, that is typically how a full upper and a full lower denture would look. So we want these smooth and polished surfaces on these pink areas of the teeth. So when you look at it within the light, you would like to see a shiny reflection bouncing off. We want clean pink surfaces. So when you have a look at your dentures, especially in these areas where the in-between sections of the teeth develop, as well as here towards the back of your denture, you might see a little bit of a yellowish, almost looks like sandstone that you build houses with, application that's on the denture. So that's actually plaque that sits on the denture and it hardens due to the saliva or your spit, and it actually forms calculus. So those are the types of things that we really need to ensure that we remove it from your denture, as that becomes a harbor for plaque and other bacteria. We want to see clean and glossy teeth. So that would literally be the teeth in this area here. As we get stain formation on the teeth will discolor over time. So, and we will discuss some different ways to actually clean the dentures as well. You want to look at your teeth, especially these back teeth where you chew, and you want to still see those little edges of the teeth. We call those little edges cusps. Once those little edges or cusps become flat, you really need to visit your dentist in order to assess your denture again, because that causes your occlusal vertical dimension, which is your facial height. That would be the space between the bottom of your nose and the bottom of your chin would actually decrease. And then you will see these folds or commissures would actually then start to go a little bit more closed. And then you have saliva or spit pooling there, and then you can get some broken corners there and other infections on the skin. So it's really important to assess those teeth and those little cusps that we see on those denture teeth, that they are actually still in a good condition. When you look at your denture while you are biting and you were to look in the mirror, you don't want to see an open bite like that. Your teeth really needs to fit into one another like a puzzle, because once you have those tight contacts in between the teeth, it also increases the efficiency of how the denture will perform while you are eating, and it also increases the stability, because when you have tight contacts between the teeth, it shows that there's a stable connection when the top and the bottom dentures actually touch one another, and then it does not destabilize while you are eating. When we look at these posterior areas, so that would be the back teeth. Many patients don't have back teeth at the bottom or even at the top, but they would then have a denture on the opposing jaw. Now, it's really important to fill those areas because what we see with those situations there is when we have little dentures that is in those spaces, it's able to stabilize the occlusion and it really ensures that it supports the jaw because you have a joint here which is called your temporomandibular joint. And when you have overclosure of your mouth because you don't have teeth at the back, you can also develop some joint problems. So opposing dentures get stabilized extremely well. So you will find that when you are eating, especially chewing some harder food, maybe some steak or meat, then you won't have that easy of a destabilization of your denture. Because if you improved eating, you are able to then also chew your food much better, and you would then have less gastrointestinal problems if you are somebody that really needs the food to be chewed much finer in order for that to be processed by your body. Because your denture is stable, it does not have a situation where it is rocking back and forth or side to side, and therefore you will have less problems on the gum as well as ulcer formation because that rocking of the denture can cause a lot of erosion of the soft tissue and cause little ulcers. When you look at your denture, and for this one as an example is a top denture, so that surface where you see the arrow is actually the fitting surface of the denture where it touches your palate, all right? And you can clearly see that that surface is not the same pink as the rest of the denture. So that means that that plastic or the acrylic of the denture has been infiltrated with some kind of a microbial agent. All right, usually it is something that we call Candida albicans, which is a opportunistic infection that we get in our patients. But when you have a denture, it also changes the microbiome. In other words, the balance of the micro environment and all of those microorganisms. And then the Candida has a tendency to become stronger and more aggressive. So when they then infect your denture, you will then see staining and discoloration like that. So you really need to visit your dentist in order to assess your denture to ensure that you have a clean fitting surface. If you look in the mirror and you see that your palate in your mouth actually has some kind of a discoloration, whether it is a slight reddish or maybe just red little dots to a purple discoloration, you really need to visit your dentist in order to ensure that everything is still in a healthy condition. And then if needed, your denture would then maybe need replacement or some kind of an antifungal agent, but your dentist would be able to advise. So please don't use any home remedies when you see these types of items. Rather visit your health professional, especially your dentist, in order to assist you in those situations. There are various denture cleaning products on the market, and they all work extremely well. Here on the left-hand side, we see 4 products that was recently tested in 2016 here in our dental laboratory by some of our researchers. But it's important to note that even though a person were to use these additional aids of cleaning a denture, you still need to brush the denture actually before you place it into those products as well as afterwards. Brushing it beforehand assists with removing any large debris and also loosening the more stubborn debris that might be present. Then you place it in your denture cleanser that then assists with cleaning off some of those areas as well as loosening the even more tough areas that the toothbrush with the toothpaste or soap was not able to loosen. But then when you then brush it again afterwards, then you would really have maximum cleanliness in order to then remove all of those loose debris as well as remove the chemical agents that is actually inside these products, because you don't want to just simply take it from the denture cleanser glass that you've had it in and just place it in your mouth. You really need to rinse it off thoroughly. And by doing it as a toothbrushing technique, then you would actually then also remove the loose debris that has developed. All right, we also had a look when these researchers did their research here at our university. They actually stained the dentures. So they provided an artificial stain in order to see which one of these products are actually the best. And the results were they all removed the stain equally well. So you can really choose the product based on your needs. When we look at the composition of these denture cleansers, that was also published in our South African Dental Journal, which is part of the South African Dental Association. These researchers from our university then indicated the composition of each one of these products. And you will see I placed an arrow next to some of those items. All right, now those compositions, the sodium carbonate and the sodium perborate, are quite important to note because these denture cleansers all contain that, all right, and they are actually a type of oxidizing agent. Now, when we look at something like sodium hypochlorite, where the commercial names would be known as Milton, those blue bottles that we usually use to clean baby bottles with, as well as Jik, those are also oxidizing agents. So some dentures have soft bases. Now, a soft base is a silicone material that your dentist would have placed in your denture in order to assist with those patients that find that their lower dentures are really causing a lot of discomfort and a lot of ulcers. So those silicone bases are really sensitive to oxidizing agents. All right, it's an oxygenation process that takes place. So when your dentures have these soft bases in them made of this silicone, then you would not want to use these denture cleansers. Okay, we need to use some other techniques in order to clean it. Because as you can see, this denture's base is white and it's not supposed to be that way. It's actually supposed to have the same, more or less the same pinkish color as what the denture has there at the bottom. So here you see one of my patients where they came with their soft base denture and I said, no, okay, it's not doing the function anymore because the surface has oxidized. It has now become rough. The silicone has also become harder. So now it's not serving its purpose of being a soft base and assisting the tissue in healing and also providing that soft cushioning effect that it's made for. And then it really needs replacement. So you would then actually visit your dentist, and a person should visit them every 5 years if you have a soft base. You could do it every 3 years as well, but if it's a high quality soft base, every 5 years for assessment is sufficient, provided that it has not oxidized, as you can see there with the top denture. Now, when we look at cleaning our dentures and we decide that we are not going to use any denture cleansers as an additional item, or whether you use a denture cleanser as an additional item, this protocol is applicable for both situations. So you would like to brush it twice a day, exactly as what you would do your normal teeth. So you would brush the denture in the morning as well as in the evening. Very important, you need to ensure that you use a soft toothbrush. All right, those types of nail brush cleaners and those types of things are very hard and rough, and they will cause additional scratches on your dentures. So use a soft toothbrush morning and evening. Also use a soap. Okay, soap is really ideal because it does not have any abrasive agents in it. So generally we recommend Sunlight Liquid as being an excellent soap to use because it also results in the change in surface tension on the denture. So it really causes a nice cleaning action, and it also has a degreasing action as well. So because our food gets exposed to our denture the whole time, and all of the oiliness and fat and everything we eat does have a tendency to adhere to the plastic of the denture. So having that decreasing effect of the Sunlight Liquid really works well. When we do choose to use toothpastes, there are various trains of thoughts, both in the literature and in the professional community of the industry. What I can advise is if you are going to use a toothpaste, do not use a whitening toothpaste or a normal toothpaste which is white. All right, those toothpastes are generally a paste, and their abrasive quality is much higher than a gel toothpaste. So if you were to choose a toothpaste, which is really the second choice after Sunlight Liquid or any other type of soap being our first choice, then a toothpaste really has to be a gel toothpaste. But as I say, there is controversy in the profession about a gel toothpaste. So if you want to be really sure and have a steadfast solution that we've been using very successfully for many years, a liquid soap really is the best solution. So today I would like to thank you very much for joining us for this public webinar, and I hope that you've seen some interesting items as well as realize some of the items that you would need to discuss with your dentist. So thank you very much for joining us today.
Thank you so much, Prof. I think that was a really compact, brief, but very interesting and hopefully very useful talk for all of the members of the public that are considering getting dentures or already have dentures. Perhaps we could quickly just chat on what one should do if their denture falls on the floor and breaks in half, because I remember when I was in practice, I had a lot of people who used super glue and stuck their dentures together and put it back in the mouth. And we all know super glue is very toxic. So maybe you could give
Excellent.
us a bit of
Yes.
advice.
Yes, thank you very much. That's a fantastic question. So let's start with when we do brush our dentures, do it over the basin that's filled with a little bit of water. That when it does fall out of your hand, because look, soap gets slippery as well as toothpaste, or the gel at least, then it at least falls within the water of the basin. All right, so that's very important as a starting point. When it does actually chip, whether you chip a tooth or break the denture in half or break off a piece or anything like that, please do not glue it with super glue. Because of the cyanoacrylate that's in the super glue, it causes damage to the soft tissue. And yes, it does have a cytotoxic effect to where it touches the soft tissue. So it will
Mm,
actually cause cellular damage on your oral environment. And remember, the mouth's mucosa is extremely gentle and it
mm,
has a very high turnover rate of healing. So that is going to cause a chemical burn, is going to cause cellular damage, and we really don't want to do that. Even if it breaks off and you think I'm going to use a other type of resin glue or another type of Pratley putty and those types of things, please don't do that. Stay away from those items. Visit your dentist. It's a very simple procedure. They send it away to their dental laboratory. In many cases, they might need to take a little dental impression first in order to ensure that we get perfect adaptation of the pieces of the denture again. So please don't fix it, don't even repair it temporarily. Just put on a mask. I mean, it's not unusual nowadays to see people working with masks anywhere. You know, when people are sick, they consider it to other people, they wear their masks, so nobody will think strange of that at all. Visit your dentist with the denture as is, and then they would advise what they would need to do for you in order to then send it to the laboratory to have it repaired professionally with the correct dental materials that's compatible to the oral environment. So thank you for that question.
okay, yeah. I think also you often, I know with today's technology, you often get it back the same day when your denture is being repaired. So it's not a very long time that you anticipate
Absolutely.
walking around, with a mask on or whatever the case
Absolutely.
is.
And I mean, many of our dental practitioners, their dental laboratories are within a few minutes of their practices, and it
Mhm.
could be repaired even within an hour or two in most
Yeah.
cases. We do have some dental practitioners that also have a dental technician on site or within the same building, and then that repair could be in as quick as half an hour to 40 minutes,
Okay.
So yes, not anymore a situation where you're going to wait a whole day or 2 days for your dentures. The repairs are very quick. Even if a tooth breaks off, that singular tooth could be replaced as well. So please send it in and then let's get those things repaired in the correct manner.
Okay. Once again, thank you so much for sharing your presentation and your knowledge, and we hope to see you again on the public webinar platform soon.
Thank you very much to Sarah for inviting me, and I look forward to engaging with any person that has a question. You're more than welcome to just Google me, and then you would find my email addresses available on the internet from one of the publications. Everything's open access, so it's very easy to get some contact details. Thank you very much.
Awesome.
You're
Thank you so
welcome,
much.
Prof. Thank you.